Doctors of Reddit. How often do you see patients after they have tried to self-medicate? What is the worst mistake you have seen? First story. I was working in a clinic when a man came in with his blind wife. She is diabetic, and during my questioning, I found out she had had a few episodes of low blood sugar in the past few months, and I mean low as in unable to ingest food to raise her blood sugar. The husband told me he had to inject his wife to bring her around. Usually, in these cases, you would inject glucagon, which is basically the opposite of insulin. It raises blood sugar. He proceeds to tell me that the glucagon is too expensive, so he has been dissolving sugar in water, drawing it up, and injecting it into her thigh. I tried to hide my shock, but it must have been obvious. He just looked at me and said, "Well, it worked, did it not?" I tried telling him all of the reasons he should use glucagon and not sugar water, but he would not have it. I even told him that the pain of the injection is probably what woke his wife up, not any increase in blood sugar. He said the glucagon was too expensive. I called around to a bunch of pharmacies and found it for $20 for 2 injections, but he still refused to buy it. We ended up calling Adult Protective Services. Husband injected his blind diabetic wife with sugar water to revive her from low blood sugar episodes. Second story. A lady in her mid-60s comes in with a terrible burn on her hairline and scalp. I asked what happened, and she said she was coloring her hair with the leftover dye from a month or so ago. Needless to say, she had a 3rd-degree chemical burn all over her scalp. Okay, that is problem 1. We ask her if she has any allergies because we want to give prophylactic antibiotics. She says no. We ask about her daily medications, and she rattles off a bunch including 1,000 milligrams of amoxicillin augmentin. We ask how long she has been taking the augmentin. She replies 2 years every day. For 2 years, she has been taking massive doses of antibiotics. Her reasoning: to keep myself from getting sick. We went hunting for side effects, found oral and vaginal thrush, massive yeast infection in her colon, malnutrition, stomach ulcers, and multiple open sores on her feet and knees. Plus, she got a super infection on the burn site a few days later. No fun. Do not take antibiotics if you do not need them. Seriously. Third story. Heard about a 911 call that went something like this. Operator. 911. What is your emergency? Caller. My 4-year-old daughter ate some ants. Operator. Oh, ants around here are not toxic. She will be okay. Caller. Oh, that is good. I fed her some ant poison just to be sure. Operator. You better bring her in. Fourth story. Pathologist. I have seen a few cases of patients who basically wrecked their livers through the use of some sort of herbal remedy, like for weight loss or something similar. Be careful with unregulated dietary supplements, is what I am saying. Fifth story. I work in a dental office. The most common thing we see is people placing an aspirin on their gums next to an aching tooth. All that does is severely burn the gums and make the pain worse. I have also met a few people over the years who have taken their own teeth out with a pair of pliers. One guy we saw had a problem tooth, went to pull it out, pulled the wrong one, then tried again and pulled the problem one. He shattered the alveolar bone in that area and had to be sent to an oral surgeon immediately. Sixth story. Medical student here. Literally all the time. I have seen super overdosing over-the-counter medications. A guy with bloody stool and abdominal pain who we found out used 4 goody mix of pain medications in crushed form powder packets a day for over 5 years. A patient who had someone try to nail file his hemorrhoids. Not sure how he thought that would help. Massive infections from people literally stapling a wound shut with an office stapler. Seventh story. Physician here, the one that stands out from among the rest of the field. Life-threatening problems with over-the-counter acetaminophen, ibuprofen, naproxen happen all day long. Happened many years ago while I was a medical student. I was serving my rural medicine rotation at a primary care practice in a remote area. A man came in for an urgent appointment for a rash. I went to see him first to get working on the history. In the examination room, I met a very nice young, fit man sitting bolt upright on the examination table looking very uncomfortable. During the history, it was revealed that he was a telephone line repairman and was working in late summer out on the telephone lines around the county, climbing them to reach the wires. He had been exposed to poison ivy this way over both arms and much of his torso, which had happened before. However, this time the rash was worsening with time. I asked him to remove his dark-colored shirt, and after he did, I almost fainted. He had open wounds all over his arms and chest. All of the blisters from the poison ivy had unroofed, and the tissue underneath was destroyed. Everything was bright red, bleeding and weeping. It looked intensely painful. I am having a hard time describing it. It was the worst skin findings I had ever seen. I thought for sure this was Stevens-Johnson syndrome or toxic epidermal necrolysis, so I started asking about medication use. He told me he takes no medications at home, but that his grandmother gave him a gallon of solution to put on the rash, which he had been using regularly since the poison ivy began. He did not know what was in it. We called Grandma. What was in it was bleach. He got to go for a fun trip to the burn center. Poor guy. A man treated really bad poison ivy with bleach, and lots of skin was lost. 8th story. Heard the story but did not see the patient. A woman in her 60s presented to the emergency room with episodes of passing out during sexual intercourse. She underwent a full workup, cardiac, neurological, when she was admitted, and no cause was found, so she was discharged. She returned again with the same complaint a few days later and divulged that this had actually happened during sexual intercourse both times. Upon further questioning, it turns out that her husband had been using topical nitroglycerin paste on his penis for erectile dysfunction. When they had sexual intercourse, the medication was absorbed into her bloodstream, causing her blood pressure to drop precipitously. Her husband was advised to discontinue this practice. 9th story. I am a medical student. I have two that stand out. First, we had a man come into the free clinic complaining of knee pain. He is a larger man, an ex-football player who developed a bit of a stomach after he stopped playing. He said that he has some old injuries, torn meniscus, chronic arthritis, and so on. He used to go to his doctor in another state, who would drain the knee and give him a steroid injection every so often. When he lost his job, he lost his insurance too, hence being seen at the free clinic. Before he decided to come to us, though, he decided it was a good idea to take a needle and try to drain his knee himself. 4 times. On physical examination, the knee is massively swollen. Tender, bright red, classic signs of a septic joint. We were not equipped to treat it in the free clinic, so we strongly encouraged him to go to the emergency room. He did not want to go because of his insurance situation. We tried to explain the gravity of the situation to him, but he refused to listen. Without prompt treatment, he could end up losing his leg. We offered to call him an ambulance to take him to the emergency room, but he refused and left the clinic. We never did find out what happened to him. Second, this one I heard secondhand from a classmate. We had a firefighter come in with some burns on his leg. I believe they were incurred from a drunken cooking accident rather than any on-the-job heroics, but I could be mistaken. Anyway, the burns were serious, but he was expected to make a full recovery quickly enough. He was discharged and instructed to eat a lot of protein to help him recover. He interpreted this as get as much protein into your body as possible, by any means necessary. He goes home, takes some protein powder and mixes it up with water and sets it up in an intravenous. Needless to say, he developed a pretty serious bloodstream infection. It prevented his burn from healing correctly, and he ended up needing a partial amputation of his foot. He eventually recovered. But it took much longer and there were so many unnecessary complications. 10th story. We had a patient come in who was using duct tape to treat various skin ailments. Not the end of the world if you have a wart, and just use a small piece of it only on the wart. This woman was using giant strips of duct tape that she would leave on for months at a time, on her face, her arm and foot. When the duct tape was removed, huge square portions of her skin came off with it. She has a long rectangular scar on her face now from it. 11th story. My uncle is a doctor, and a few years ago, when I was trying to figure out if I wanted to go into medicine or not, he let me shadow him in his office for a day. Well, this one girl came in to see him. She was absolutely beautiful, in her mid-20s, perfect makeup, hair, everything. She was in to see my uncle because her toe was in unbearable pain and she could barely stand to walk anymore. Well, my uncle has her take her shoe off and I almost threw up. He had to take a second and turn away to collect himself. Her toe was like 3 times its size, and the outside looked slimy and like the skin was about to drop off. After a few seconds of stunned silence, my uncle asked what happened to it. She said she was walking one day and she cut her toe pretty bad on some glass while she was at her apartment. She called her grandmother and asked if there was anything she should do to stop the bleeding and heal the infection. She said her grandmother was a shaman, and apparently she went to her for all medical advice. Well, guess what the grandma told her to put on it? Mayonnaise. Yes, she did not even clean it or anything, just plopped some mayonnaise right on it. We asked her how long she had been doing it for. 2 weeks, constantly. The smell was absolutely terrible, and when my uncle even slightly poked it with something, she would almost scream in pain. He immediately told her to go to the hospital and told her that one of his buddies would be waiting there for her. So later that day, my uncle's friend called back and said that they had to do surgery on her toe and that there were 2 or 3 pieces of glass embedded deep in her toe. He said that when the surgeon made an incision, the toe basically exploded and pus went everywhere. They had to remove all the dead skin, and almost had to remove the toe because the infection was so bad. But apparently she made a really great recovery, so that is good. My uncle and I will never forget that though. 12th story. A guy came in with a deep laceration to the leg. The genius decided he would super glue the wound shut. It became infected, and then gangrene set in. He then waited until his leg was a greenish black before coming in. He lost the leg. 13th story. A gynecologist friend in Lebanon told me about women trying to abort by themselves due to abortions being illegal. So you have the patients coming into the emergency room with hemorrhages due to knitting needle insertion, and that is a classic, but a very frequent case is massive septicemia due to the insertion of a raw piece of meat, or sometimes a dead bird. The crazy part is that those cases happen quite frequently. 14th story. I asked my optometrist about his most messed up stories. He said he had an elderly fellow who believed in a literal interpretation of the Bible. Apparently, somewhere in there it recommends liver juice to treat eye infections. So when the old man's eyes got infected, he bought chicken livers at the grocery store, held them above his eyes, squeezed them, and let the liquid run into his open eyes. My optometrist said when the man came in, his eye infections were so bad that pus was streaming down his face out of his eyes. And the best part was, my optometrist cried from laughing while telling me the story. 15th story. I am a nurse here. I had a patient who had cellulitis bacterial skin infection of both lower legs. He decided to put Vicks on them. When he came to me, the infection was so out of hand. It created scaly, thick, dry, stinky skin. His legs literally looked like tree trunks. He had some dried feces on his legs as well, and I ended up having to scrub his legs and peel the dead skin off with the doctor. It was unbelievable. 16th story. A friend is an emergency room doctor in a hospital near a prison. One of the inmates apparently had an eye that was bothering him, so he took Jesus' advice literally and plucked it out with a spoon. Self-medication? Maybe not. So does self-surgery count? 17th story. I read a story of a guy showed up to the emergency room with a raging infection. He had slipped outside of his house and cut his leg open on a water tap several days prior to him showing up to the hospital. Turns out he had shoved a piece of raw steak in the wound and sewed it up himself, using thread. 18th story. Not a doctor, but when I was about 16 years old, I started having these little red irritated spots show up on my arm. My mom was immediately like, "You have psoriasis is all, just go tanning." So I tanned for about 1 week, and they just got worse. Now I had them all over my body. I had spots on my eyelids even. So I go to the doctor finally. Turns out I had ringworm, and by tanning, I was basically rubbing them all over with the lotions and incubating while I tanned. Thanks, Mom. 19th story. We were given a case in a lecture of a man who had a rash on his foot, Googled it and decided it was eczema or some similar inflammatory disease, so ordered and applied a steroid cream. For those who do not know, these kinds of steroids act by dampening the immune system, the overactivity of which is the cause of diseases like eczema and psoriasis. However, he in fact had a fungal infection and was just reducing his body's ability to fight it off. If I remember correctly, by the time he got to the doctors, he needed it amputated. To sum up, go to the doctor. 20th story. Pharmacist here. A patient came in and wanted to self-medicate his cat's pink eye. He wanted to know what the veterinarian would prescribe and if it was available somehow over the counter. After a very long and trying discussion, he is insistent on putting generic Neosporin in his cat's eye. I repeatedly instructed him that it was not safe due to sterility reasons and that it could harm the cat, worsen the cat's condition, or cause some other problem for the animal. His reply to me: Well, I will try it in my own eye first and see, and just like that, as mysteriously as he arrived, he was gone. 21st story. Emergency room doctor. The first one that comes to mind, although probably not the worst, was a woman who came in with worsening back pain. She had fallen the previous day, filled a bag that was the size of a gallon with ice, and placed it on her back. She fell asleep with it on her back, and a few hours later she noticed that her back hurt even worse. So she took another bag of ice and put it on, and once again fell asleep. When I examined her, she had 2 large areas of burns with blisters on her upper back, each about 6 inches in diameter. When I took a picture and showed it to her, no, I will not post the picture, her eyes welled up with tears. She could not believe that ice had given her a 2nd-degree burn. 22nd story. Resident physician here. I have had numerous patients who have rejected medical treatment for a small, localized, and easily treatable cancer in favor of naturopathic or homeopathic remedies. Inevitably, they present again years later with diffusely metastatic cancer in their brains, liver, and bones. It is everywhere. By that point, the conversation shifts from how I can cure them to how I can make them comfortable before they die. 23rd story. A mother came to me with her child who was really obese. I mean, I have never seen anything like him before, with very specific features. She originally came because he had a sore throat, but after taking a history from her, I found out that 6 months ago he had a severe allergy and a doctor prescribed steroids for him. Then the mother thought that in order for him to not get that allergy again, she would keep giving him steroids. So he has been taking steroids for a straight 6 months, developed what is called Cushing syndrome, the high body weight and specific features, and to only think she came because of the sore throat, not this. I was so irritated that day. 24th story. My great aunt was a naturopathy fan. She had a small wound on her leg and insisted on treating it with mud from anthills. She developed gangrene and sepsis, refused to be hospitalized, and died. 25th story. About once a month, I will see a patient in my office who tried to drain their own abscesses or boils with sewing needles, only making it way worse. By the time I examine them, I usually have to send them to the hospital for intravenous antibiotics. But without fail, every patient will say, "But I dipped the needle in alcohol first so I would not get infected." Basically, do not do surgery on yourself at home. I cannot believe how often I have to tell people that. 26th story. People with tooth pains trying some miracle remedy, and when the pains stop, they think they are healed. What they do not know is that it means their nerves have been infected. In fact, it is so serious that the nerves died and are rotting below the gums. Only until the pains start again and their so-called remedy does not work do they go to the dentist. By then, there is no choice but to remove the teeth and probably some additional surgery too. By the way, dentists poke sharp objects at your gums for a reason. It is to check for periodontal disease. 27th story. I did a magnetic resonance imaging on a patient who had treated her breast cancer with sodium bicarbonate. The patient presented to the emergency department with numb hands and neck pain. The magnetic resonance imaging showed extensive bony metastases and a pathological fracture of the 2nd cervical vertebra. Basically, the cancer had spread all through her body and had weakened her bones to the point that they were disintegrating, putting her at risk of damaging her spinal cord, or worse. It is more just sad that people want to believe that these simple remedies can treat complex issues as opposed to modern medicine. 28th story. Not a doctor, but I was observing in the emergency room for this. During my senior year in high school, I did a program called New Visions that allowed seniors to skip half their day at school and instead spent it job shadowing doctors, surgeons, nurses, physical therapists, and so on. I scrubbed in surgery, saw a bunch of births, vaginal and cesarean section, assisted during codes, and was eventually certified as an emergency medical technician basic through the same program. It was awesome. A man comes into the emergency room after trimming trees on his farm, and a very large branch had landed on his head. He had split his skull, and instead of going to the emergency room, he had his wife clean his scalp with vodka and staple his scalp shut with a staple gun and thick sewing thread that they used on horses. According to him anyway, it was severely infected and nearly gangrenous. Several of the staples had created microfractures on the skull too, apparently. The emergency room doctor's face when the man nonchalantly described how he just got drunk and had his wife use the staple gun on his skull was hilarious. The man had to go into surgery, and it took about 6 hours and several skin grafts to repair the damage. 29th story. I am not a doctor, but this is important. About 10 years ago, my now mother-in-law had what everyone thought was a severe panic attack or mild heart attack. They rushed her to the hospital and found out it was her gallbladder. She said it was nothing serious and did not get it removed. About 3 years later, the same thing happens. A possible heart attack turns out it is her gallbladder. Her husband, my wife, and I were all there in her room when the doctor was recommending taking it out. She says no. The doctor then tells her no more spicy food, junk food, or fast food. After he leaves, she starts going off about how doctors just want to cut people open to make money, and I swear, she says, I just need lemon juice. That will fix it. Fast forward another 3 years later of not listening to a doctor and taking lemon juice. My wife gets a call around midnight from her dad, who is mumbling incoherently. After about 30 minutes, he explained to my wife that my mother-in-law had woken up screaming painfully, and he had rushed her to the emergency room and was scared she was going to die. The hospital had told him that she was going into emergency surgery. About 4 hours later, we found out that they had removed her gallbladder and that it had actually ruptured. She is still alive and still tries to give my wife and me medical advice. 30th story. I was just a student doing some research in North Africa at the time and had met a really lovely family there. About 2 months into knowing them, I found out one of the women around my age had dropped a pot of hot oil on her foot. The burn was devastating, ranging from partial to full thickness. I had a hard time telling at the time, but suffice it to say it was an incredibly bad situation. I was in a village working, so I could not get to her for about a week or so. But when I arrived, I found her on the rooftop, with her foot sitting in the mid-afternoon sun, in tears from the pain. She told me that because there was water in it, her brother, who read it online, told her to put the foot in the sun to dry it out. I explained to her that this was nonsense, and her brother came to argue with me. Since I was still a student at the time, not that it takes much medical training to know better, and a woman, most Moroccan men were not this condescending, by the way, but he knew better. He read it on Yahoo Answers after all. I insisted that he was full of nonsense politely, and finally, getting sick of him, went downstairs and hailed a cab myself. I took her to a doctor who got her proper medication and taught her husband how to dress and clean the wound nobody had shown him, not even the doctor they went to initially. I also later taught him how to cook dinner, as apparently he had no idea how to feed himself with his wife immobile. In the end, she was fine. Her foot healed well with only minimal scarring. But I will never forget the look on her face as she sat there burning her burn in the sun. 31st story. Not a doctor, but a close friend who worked in home health care in a very low-income area. He said he went into a home where the woman was complaining of pain in her stomach and her pubic region. He started questioning her. What kind of daily activity did she engage in? Was she sexually active? Did she use birth control? And so on. Come to find out that yes, this woman was sexually active. Her form of birth control: a potato carved in the shape of a diaphragm. Potato plus nice warm, wet environment equals a holy hell disaster. Batman. 32nd story. Had something happened to me when I was about 13 or 14. Was at a friend's birthday party and we were playing in the woods. I stepped down on a train track spike that had been nailed through a piece of wood and left standing up, as though someone had left it as a joke. I did not want to go home, and my friend told me he stepped on nails all the time and would just duck his wound. So I put a sock on it and spent the night with an uncomfortable throbbing foot. When I got home the next day, my mom looked at my foot and knew we had to immediately get to the emergency room. The doctor we saw told us he had never seen an infection spread so rapidly due to the toxins and other foul substances that were on the bottom of my shoe that got carried into my foot by the nail, and told us that had we waited another day I would have lost the foot. 33rd story. Not a doctor was told this story by a family member who witnessed it. Before you read this, note it was in Amish country. A family was making dinner and was pulling the food out of the oven. As the mother was pulling out the food, she had to check something momentarily. Her son, who was still a toddler, was playing in the house and was running around like every kid. He ran up to the stove and wanted to look inside of the container with the food in it. He grabbed onto the container, which burned his hands, and tried pulling away, only to spill everything all over him right after it was taken out of the oven. He had nearly full-body second and third-degree burns, but being Amish, they would not take him to a modern doctor. They tried to use a home remedy of some sort, which only made it worse. It was infected badly due to their brilliant medication techniques by the time they finally decided to get actual help. Help came too late and the child died from it. I do not know the exact details because it was a hand-me-down story, but I described the specifics. Amish kid got full body burns. Amish family prescribed him with paste that infects the wounds and he dies right after family realizes their medication is not working. Edit. I checked and the child was not burned with food, but with boiling water. It also took them nearly an entire day to decide that the boy was dying for them to go get help. 34th story. Not a physician, but my mother is. The patient chops off a fair bit of their toe with a pitchfork, not into the bone. He did not go into the emergency room. Later, when he did decide to go to the emergency room, my mother asked what the odd black specks in the wound were. To disinfect the wound, the patient sprinkled fucking black pepper on it. He did not go into the emergency room until the toe started smelling. Needless to say, he lost the toe. 35th story. Anesthesiologist. A few years ago, one of our certified registered nurse anesthetists self-diagnosed her skin rash as atopic dermatitis. She asked around and finally convinced one of the anesthesiologists she worked with for a 5-day course of oral steroids, which is a potent anti-inflammatory. She was leaving on her Caribbean honeymoon and wanted to get the rash cleared. She gets married and leaves for her honeymoon, only never to return. On the trip, she gets very ill and dies. Mind you, she is in her mid-30s and in perfect health prior to her departure from the United States. Her new husband is detained by the authorities for questioning given the bizarre and rather unexpected nature of her demise. Well, it turns out her skin rash was actually streptococcal dermatitis, and the immune suppression brought on by the steroids she had essentially self-prescribed put her at risk for, and eventually led to her succumbing to overwhelming streptococcal toxic shock syndrome, leading to sepsis and ultimately death. 36th story. Very late to the same, but this is amazing. My boyfriend decided to buy a laser hair removal machine and laser his own testicles. The directions said not to go over the same areas over and over, but he thought it would work better if he did. His poor testicles were burned and swollen from being zapped over and over, and they were quite painful. The hair follicles started getting infected, which made the pain worse. He did not want to see a doctor and explain what happened, so he decided the best solution was to cover them in a thick layer of Perception acne cream. A few days later, they were still bothering him, so I asked to take a look. I bent down, pulled down his pants, and saw his poor swollen infected testicles covered in a tacky off-white substance. Just from looking at it, I could tell exactly what it was: yeast. He had fucking given himself a yeast infection all over his testicles. He did not believe me, so we had to go to the drugstore and buy a test, and he made me buy the Monistat for him. To this day, he still gets angry when I call him yeasty balls. 37th story. Not a doctor. A co-worker did not have health insurance and had 3 children, so money was very tight. She admitted to me that she would use fish amoxicillin used to clean fish tanks of bacteria and keep fish safe from certain infections from the pet store in place of prescription penicillin amoxicillin when her children got sick. I thought it was pretty smart, but I am sure medical professionals would disagree. 38th story. Not a doctor, and this was not my own patient, but I recently heard about this tale that I think fits here. A man had found an abscess growing at the base of his penis. Rather than seek a doctor's opinion, he decided to take a pin, sterilize it with a lighter, then try to lance the abscess at home. I am not sure what the immediate results were, but 1 week later he called an ambulance. The area was infected, and the entire penis had necrotizing fasciitis. When a bacterial infection eats the flesh, I think Staphylococcus aureus. He had signs of systemic infection, tracking cellulitis across the abdomen, and was in generally bad shape. The patient described his genitals as resembling minced meat. The smell was apparently worse than a recent case where paramedics had come across a 1-week-old body. The doctors had to remove what was left of his penis. 39th story. Former Emergency Medical Services volunteer emergency medical technician intermediate called to a home of a man reporting severe intestinal pain and an inability to move or walk. He presented his symptoms as though he was having unexplainable intestinal cramps and could not move. We loaded him up, took him to the hospital. Our shift ended en route, so we went to grab dinner in the cafeteria. After dinner, I asked a nurse out of curiosity if they figured out this man's problem. I have never struggled so hard not to laugh at someone's stupidity in my life. This man put a candle in his rectum while masturbating. At some point, he contracted his rectum and basically sucked this candle up into his colon. This was a long dinner table sort of candle. I got to see the X-rays, tapered and round on both ends. He tried to use barbecue tongs to remove the candle. He pushed the candle higher and higher and apparently thought the best move would be to get the tongs above the candle. The tongs also fell victim to the man's vacuum-like anus. This man could not walk because he put a set of 10-inch, spring-loaded, metal barbecue tongs into his rectum. This is still my favorite story of all time. Thank you for watching this video to the end. Write in the comments under the video your similar stories. And also be sure to subscribe to our channel to not miss new super interesting videos, and I advise you to watch our other videos.